What if I told you that one of the most dangerous moments of your day happens before you've even had your morning coffee? It's not while you're driving, not while climbing stairs. It's the moment you first open your eyes. You see, in the early hours of the morning, your body is slightly dehydrated, your blood is thicker, circulation is slower, and science shows that you are up to 3 times more likely to suffer a stroke in the first 2 hours after waking up. 3 times, just because your body's internal clock is shifting from rest to action. Now think about this. Most people over 60 don't start their day with water. They wake up, skip breakfast, maybe feel a little off, dizzy, foggy, and chalk it up to age or poor sleep. But what if that grogginess isn't just getting older? What if it's your brain waving a quiet red flag? Instead of ignoring these signs, what if your day started with a single glass of water? Just one. Before anything else, that simple habit thins your blood, hydrates your brain, and protects your most vital organ before it's even tested. Because the truth is, stroke doesn't always knock loudly. Sometimes it whispers. And your best defense? It begins the moment you open your eyes. Let's talk about that. Let me ask you something. What do you think causes more deaths each year than breast cancer, prostate cancer, and car accidents combined? It's not something dramatic. It doesn't always scream for attention. In fact, most of the time, it comes quietly. It's stroke. And here's the part that hits hardest. It doesn't always come with warning signs we recognize. But imagine if knowing just a few simple truths could protect your brain, your memory, your independence. Because what you don't know can hurt you. But what you learn today, it might just save your life. So what exactly is a stroke? To put it simply, a stroke happens when blood flow to part of your brain is suddenly cut off. It's like turning off the water to a garden hose. The plants begin to wilt in minutes. In your brain, those plants are cells that control speech, movement, memory, everything that makes you, you. There are two main types of stroke. The most common is called ischemic stroke. It makes up about 87% of all cases. That's when a clot, or a buildup of plaque, blocks a blood vessel in the brain. The second is a hemorrhagic stroke. Less common, but often more severe. That's when a blood vessel bursts, causing bleeding inside the brain. Both types can be life-changing. Both strike fast, and both can start with almost no warning. Let me tell you about Evelyn. She was 68, a retired teacher. She walked every morning, ate her veggies, never smoked. She felt pretty healthy. But she ignored one thing, her blood pressure. It had been a little high for years, she said. But since she felt fine, she never really worried. One morning, while reaching for her coffee, the mug slipped from her hand. Her words slurred. She couldn't move her right side. Her husband saw what was happening and called 911 immediately. That call saved her life. Now, Evelyn's story isn't rare. It's happening to people just like her every single day. People who feel fine until they don't. Because a stroke doesn't wait for a red flag. It often comes without one. And the only way to fight back is to understand it before it strikes. Now you might be wondering, why does this happen more often after 60? Why do people who've lived full, active, healthy lives suddenly face something so serious, so unexpected? It's not about weakness. It's not about bad luck. It's about time. Because as we age, silent changes are happening inside our bodies. Some we can't feel, Others we brush off. But if we understand those changes, we can control them. And if we control them, we can prevent what feels uncontrollable. So, why does stroke become more common and more dangerous after 60? Let's look at 4 reasons. These are changes that happen slowly over time. And most of them are invisible, until they're not. First, aging blood vessels. As we get older, our arteries naturally stiffen. They lose their flexibility. That makes it harder for blood to flow smoothly and easier for clots to form. Think of your blood vessels like garden hoses. A new hose bends easily, and water flows without a problem. But an old, stiff hose? It cracks, it clogs, and it doesn't flow right. Second, high blood pressure. This is the #1 cause of stroke in older adults. When your blood pressure is high, your arteries are under constant pressure, day after day, year after year. That pressure wears down the inside of your arteries, especially the tiny ones in the brain. They become more likely to rupture or get blocked. And here's the catch. Even borderline blood pressure like 135/85 can double your risk of stroke over time. That's right, double. So instead of thinking, it's not that high, think, it's high enough to matter. Third, irregular heartbeat, especially something called atrial fibrillation, or AFib. This is common after 60, and often goes unnoticed. You might feel a flutter in your chest, or nothing at all. But what's happening is blood is pooling in the heart. That pooled blood can clot, and if that clot travels to your brain, it causes a stroke. Fourth, diabetes and cholesterol. High blood sugar damages blood vessels. High LDL cholesterol builds plaque inside them. The two together form a dangerous duo, narrowing pathways your brain depends on. So instead of waiting for symptoms, what if you focused on what's happening beneath the surface? Because the truth is, these risk factors are silent. But they're not unstoppable. When you know them, you can act. And when you act, you protect your future. Let me pause and ask you something important. So far, have you seen yourself or someone you love in any of these risks? Maybe your blood pressure runs a little high. Maybe you've felt a flutter in your chest. Maybe you've skipped that morning walk more often lately. Don't wait for a major wake-up call. Pick just one small habit to start today. 1. Because preventing stroke isn't about perfection. It's about momentum. And the sooner you start, even with something simple, the stronger your brain will be tomorrow. So, what will you choose today? Let's keep going. Have you ever had a moment that felt strange? Maybe your hand went numb for just a minute. Maybe your words came out jumbled, and you laughed it off. Maybe you stood up too quickly and felt dizzy. But it passed. What if that wasn't nothing? What if that one odd moment was your only warning? Because sometimes the signs of a stroke don't scream. They whisper. And ignoring them could mean missing your chance to act in time. Now let's talk about the 7 warning signs you should never ignore, even if they last just a few seconds, even if they go away. Because these are your body's whispers, and they may be the only warning you get. 1. Sudden numbness or weakness, especially on one side. Imagine reaching for your coffee, and your hand just lets go. Or one leg feels heavy, like it doesn't belong to you. It might pass in minutes, but don't wait to see if it comes back. Weakness on one side? That's your brain saying, something's wrong. 2. Trouble speaking or slurred speech. If you find yourself struggling to find the right word, or if someone tells you your words sound slurred, take it seriously. Stroke can affect the part of the brain that controls language, and sometimes you may not even notice it yourself. 3. Sudden confusion or trouble understanding others. Getting lost mid-conversation, forgetting where you are, feeling like the words around you don't make sense. This isn't just a senior moment. It could be a sign that blood flow to your brain is being interrupted. 4. Vision problems in one or both eyes. Blurry, double vision, or sudden blindness, especially in just one eye, could signal a stroke. One woman I worked with said it felt like a curtain was pulled over half her vision. She nearly ignored it. I'm glad she didn't. 5. Dizziness, loss of balance, or coordination. If you suddenly feel off balance, or like the room is tilting, don't brush it off, especially if you're also feeling weak or confused. The part of your brain that controls balance may be under attack. 6. A sudden, severe headache. Not just any headache. This one comes on fast, hits hard, and feels different. If you feel pressure, nausea, or neck stiffness, don't lie down and hope it passes. Call for help. 7. Facial drooping. Look in the mirror. Smile. If one side of your face lags behind or doesn't move, act fast. It may come with other symptoms, or be the only sign you get. So how do you remember all this? Use the FACE-T method. F. Face. Does one side droop? A. Arms. Can you raise both? S. Speech. Slurred or strange. T. Time. Call 911. Every second matters. Because when a stroke hits, every second saves brain. Now here's the part that surprises most people. What if you've never had a symptom? No numbness, no speech issues, no dizziness. You might think, I'm fine. But that's exactly what makes stroke so dangerous. Because the real threats, the ones that build up slowly, don't feel like anything at all. Not until it's too late. But what if you could catch those silent threats early? What if knowing what's happening inside could save everything on the outside? Let's pull back the curtain and look at what's really going on inside. Because stroke rarely begins with a big, dramatic moment. It builds quietly, through habits, routines, and numbers we often ignore. Here are 7 silent risks you can start managing today. 1. High blood pressure. It's the #1 cause of stroke, and it often comes with no symptoms at all. Even readings like 135/85, which many still consider not bad, can double your stroke risk over time. Instead of waiting to feel something, check your pressure daily. Track it. Share it with your doctor. 2. Diabetes and high blood sugar. High glucose damages the lining of your blood vessels, making them more fragile and more likely to clog. And get this, even prediabetes raises your stroke risk. Instead of skipping meals or eating sugary breakfasts, choose stable, balanced foods, fiber, protein, healthy fats. 3. High LDL cholesterol. It builds up like sludge in your arteries. You may not feel it, but over time, it narrows the passageways that feed your brain. Instead of fried or processed foods, try oats, beans, berries, olive oil. These don't just taste good. They clean up your arteries from the inside. 4. Irregular heartbeat, especially atrial fibrillation. AFib often goes undetected, but it causes blood to pool in your heart, form clots, and send those clots to your brain. 1 in 3 untreated AFib patients will suffer a stroke. 1 in 3. Talk to your doctor. A simple EKG could change your future. 5. Smoking. If you still smoke, your stroke risk is nearly twice as high. The chemicals damage blood vessels and reduce oxygen to the brain. But the moment you quit, healing begins. In weeks, your circulation improves. In months, your risk drops. 6. Sedentary lifestyle. Sitting still may feel harmless, but it slows blood flow and weakens your heart. Instead of staying still, get up and move every hour. Even 5 minutes of walking makes a difference. 7. Chronic stress and isolation. Loneliness raises inflammation. Long-term stress spikes your blood pressure. Instead of bottling things up, reach out. Talk to a friend. Join a group. Your brain needs connection. Because the biggest danger isn't what you feel, it's what you don't. And every one of these risks, you can do something about them. Starting today. Let's talk about something simple. Something you already do every single day. Eat. Now here's the truth. Most strokes aren't just built in the hospital. They're built in the kitchen. Not overnight, over years, through quiet choices made at breakfast, lunch, and dinner. But here's the good news. You don't need a trendy diet or a cabinet full of supplements to protect your brain. You just need the right foods, in the right balance. Let's build a brain-smart plate. Start with vegetables. Half your plate should be colorful, crunchy, and rich in fiber. Spinach, broccoli, peppers, carrots. These lower blood pressure and fight inflammation. Next, add lean protein. 1/4 of your plate. Grilled chicken, fish, beans, or tofu. Protein keeps your energy stable and your blood sugar in check. Then, whole grains. The last quarter, quinoa, oats, brown rice. These grains help regulate cholesterol and give your brain long-lasting fuel. And don't forget healthy fats. Olive oil, avocado, a few walnuts. They protect your arteries and reduce clotting. Now, what should you eat less of? Salt, sugar, and saturated fat. Most of the salt we eat hides in processed foods, frozen meals, deli meats, canned soups. Too much salt raises your blood pressure. Too much sugar spikes inflammation. And saturated fat builds plaque in your arteries. Instead of thinking of food as comfort, think of it as protection. Every bite is either helping your brain or hurting it. So the next time you look at your plate, ask yourself, is this fueling my future or feeding my risk? The choice doesn't have to be perfect, but it does have to be consistent. Now let's talk about your daily rhythm, because stroke prevention doesn't come from one big action. It comes from the little things you do without thinking. Here are 7 simple habits that can protect your brain, your independence, and your future. 1. Drink water first thing in the morning. After 6 to 8 hours of sleep, your blood is naturally thicker. That's why most strokes happen in the early morning. So instead of reaching straight for coffee, drink a full glass of water first. It helps thin your blood and support brain circulation. 2. Move every day. You don't need a gym, just move. Walk 10-20 minutes twice a day. Stand and stretch every hour. Because a body at rest for too long becomes a body at risk. 3. Check your blood pressure at home. Don't wait for your doctor to find a problem. Use a home monitor every morning and evening. Keep a log. Share it. Instead of guessing, you'll be in control, with data to back it up. 4. Eat consistent meals. Skipping meals, especially breakfast, causes blood sugar swings, cravings, and fatigue. Instead of skipping, eat smaller, balanced meals every 4 to 6 hours. Your brain needs steady fuel. 5. Prioritize sleep. Poor sleep raises blood pressure and inflammation. Aim for 7 to 8 hours a night. Keep your room cool, dark, and quiet. If you snore or feel exhausted in the morning, Talk to your doctor about sleep apnea, because sleep isn't a luxury, it's brain protection. 6. Manage stress. Just 5 minutes of deep breathing twice a day can lower cortisol, calm your heart, and reset your nervous system. Instead of staying tense all day, give your brain room to breathe. 7. Stay connected. Call someone, join a group, volunteer. Because loneliness doesn't just hurt your heart, it affects your brain too. Instead of thinking, "I'll change later," try one thing today. Because these small habits, they add up to something powerful. Prevention. But let's be honest, even with the best habits, what if a stroke still happens? Would you know what to do? Would your loved ones? Because in that moment, when the symptoms start, every second counts. And the truth is, many people lose precious time. Not because they don't care, but because they don't recognize what's happening. So let's walk through it together. Because being prepared could save your brain or someone else's. If a stroke strikes, what you do next can change everything. Because when a stroke begins, your brain starts losing nearly 2 million neurons per minute. Time is not on your side. But the right action? That's your power. Here's your stroke emergency plan. Step 1. Recognize the signs. Fast. F. Face. Ask them to smile. Does one side droop? A. Arms. Can they raise both? Does one drift down? S. Speech. Is it slurred or strange? T. Time. If any answer is yes, call 911 immediately. Don't wait. Don't drive them. Don't second guess. Paramedics can start treatment on the way and alert the ER to be ready. Step 2. Stay calm, but move fast. Note the exact time symptoms began, even if they stop. Doctors need that to decide if clot-busting medication like TPA can be used. Keep the person awake and seated upright. Do not give food, drink, or medication, unless told by a medical professional. Step 3. Be ready with information. Have their name, age, current medications, allergies, and medical conditions, especially high blood pressure, diabetes, or AFib, written down and accessible. Post this near the fridge, or save it in your phone, because when minutes matter, preparation saves lives. Step 4. Know what happens next. At the hospital, doctors will scan the brain to see what kind of stroke it is. If it's a clot, they may use medication. If it's bleeding, they'll act fast to control pressure and stop damage. Instead of hoping it's not a stroke, know what to look for and how to act. Because hesitation costs time, and time costs brain. You've made it to the end, and that tells me something powerful. You care about your brain, your independence, your future, and maybe even someone else's. So here's what I want you to do right now. Print the FACE signs. Post them on your fridge. Choose one new habit. Start it today. Not next week. Not when things calm down. Today. Because stroke prevention isn't about fear. It's about freedom. The freedom to stay sharp, to keep moving, to live on your own terms. And if this video helped you, share it with someone you love, your spouse, your neighbor, your adult children. Because knowledge is power. But shared knowledge? That saves lives. You've got this. And you're not alone. We're building something stronger than just awareness. We're building momentum. One habit. One household. One life at a time. So thank you for being here. And I'll see you in the next video.